It's important for us to understand lifespan. Usually this class is called FAMR, in which we learn about different age groups and their development, both psychologically and physically, from birth until late adulthood. It is important as EMS providers and professionals that understanding the normal vital signs for each age group, as well as how to understand the physical development, psychological and emotional components that go along with each lifespan and life group, so that we know how to communicate and evaluate their normal baselines, given that there may be a change in their vital signs or cognitive effect or social patterns or means of how they communicate. Simply stating, each age group has certain obstacles or barriers to their health. So for example, a newborn cannot communicate easily with language because the child or that infant has not developed those skills. Likewise, in late adulthood, although we have these communication skills, sometimes these patients may suffer from dementia, Alzheimer's, or some type of neurological disorder that makes it difficult for them to communicate adequately with us. On this video slide, we see some normals for heart rate and blood pressure, as these numbers sometimes are testable. We'd like to keep in mind that the norms, as you see, change and become more normal for the adult. Meaning that if you can remember what the adult range is, your pediatric ranges should be at least half to twice the normal of the adult. Infants, neonates, usually have respirations at about 40 to 60, heart rates ranging between 140 and 160, and a systolic blood pressure of about 70. They have an average of about 6 to 8 cc's of blood volume per kilogram. As they tend to develop within the neonate, that first 24 hours, and become the infants, these start to slow down, blood volumes start to increase over that first year, and their blood volume may increase from 6 to 8 cc's per kilo to about 15 to 10 cc's per kilo. Certain soft spots called fontanelles on the top of their head will tend to close. The muscles become more deformed, more formed, and the bones become more solid and more developed. A toddler is about 3 years old. Preschooler is about 6. Their body systems are adequately developing. They're able to stand, walk, run, maybe it's skip, and to start to piece together basic sentence structure. By the time they hit school age or preschool, they're between the 6 and 11, in some cases 6 to 9. Their heart rates are becoming more normal, between 75 and 120. Respirations somewhere between 18 to 25, 26. And their systolic blood pressures above 90, between 97 and 115. They're starting to identify with gender roles, and they've left that toddler stage where they have more anxiety towards strangers, and are developing their own way of communicating. As they become more towards adolescent, pre-adolescent, they become more physically developed. They understand friendships. Adolescence is between 13 and 18 years old. Their blood pressures, heart rates, and respiratory rates tend to become more as normal. They like to be treated as adults, and they're very aware of their body image. Early adulthood is between the ages of 20 and 40. This is where we see some of more our high risk taking behaviors. Heart rates, blood pressures, and respiratory rates are all about the normal for adults. As we hit middle adulthood, the age range between 41 and 60, these patients now suffer from what we consider degenerative health conditions such as diabetes, heart disease, blood pressure, high cholesterol. In late adulthood, 61 years of age and older, these individuals start to lose functions of the kidney as well as bone and muscle degeneration. They may also suffer from those chronic degenerative diseases. They may have lost loved ones or their spouse. They may live alone. They may also feel a loss of independence. And we have hearing loss, vision loss, and mobility issues. In these different age groups, keep in mind that if they are on medications, that the medications can affect the numbers that we have here on our video slide. They may cause the heart rate to be lower, blood pressure to be lower. They may be on medications to increase their respiratory rate. They may be on oxygen or breathing devices to help them to breathe. In the younger age groups, neonates and on up to pre-adolescents, these children may have been afflicted with cerebral palsy or other genetic predisposition illnesses that require them to be hospitalized, wheelchair bound, bedridden, or require mechanical devices for their mobility and or for ventilation and feeding. It is always important to keep in mind that the family members of these individuals with these type of illnesses and medical health conditions are very versatilely trained and educated. Use these family members for information and guidance to identify their normal vital signs and mental status. Again, it is important for us to remember these developmental, psychological, emotional, physiological changes throughout the lifespan so that we can identify what their norm would be or their baseline would be to determine whether there is significant changes.